So where's the tooth? So obviously, you know, we see that, you know, there's a little yellow spot there. So that's part of the tooth. That gives you a clue. And so we make a flap. You make your incision and you lift up the gum. So the gum becomes a little flappy. So that's a flap. So once you have the flap, you dissect down and expose the tooth. So that's where the tooth is. So it's consistent with what we see on the x-ray, right? So now the question becomes, when you have the flap like this, can that tooth come out? Can that tooth come out intact? What do you guys think? So the general mantra is really of taking out a wisdom tooth is making the hole larger or the tooth smaller. Remove the bone around the tooth. Okay, that's the first thing I'll do. Cut the tooth into smaller segments, right? We divide it, okay? And start lifting the segments out. We reassess. Can the remaining segment come out intact? What do you guys think? It's a little bit, sometimes you can, right? You get an instrument, you try to lift it out. If it can't, don't put too much pressure on it. Remember we said that sometimes the jawbone is not too thick there, and potentially if you put too much pressure, there can, you know, you can damage the jawbone. So don't put too much pressure on that, right? Go back to your mantra. Okay, so the tooth is out. Are we done?
Most people say no.
Yeah.
Clean and sew stitches, grafting.
Yeah, sometimes you can graft, but in this case, for me, on a younger patient, I typically do not graft. But what I do, okay, and this is something that is more prevalent these days, that both you know, oral surgeons, general dentists, periodontists, we all do it, but we do something called platelet-rich fibrin, okay? So this is Dr. Bruce, okay? So this is his video. So essentially a platelet-rich fibrin is you draw from the IV, okay, you draw a little bit of blood and you spin it down, right? You spin it down and you're able to separate that blood into 3 different layers. And in the middle layer, you have your fibrin, pretty much a fibrin jelly, okay? And so you make those slugs, you see those yellow slugs, that's pretty cool. That's full of growth factors, okay? From your own blood, okay? Okay, and you put it in there, right? As somebody said, wash it out, make sure you wash it out, okay? Because a lot of times there's bone dust in there, and that's a, you know, main cause of developing infections later on. But you wash it out and then you put that jelly in there. Flap closed. Post-operative instructions, that's, you know, that's very, very important. You need to have some sort of handout so the patient can read it after. You know, as we talked about, sometimes they may be sedated, right? And they're not gonna, you know, learn everything they need to know right after surgery. And also what I do is I make sure I call the patients the night of surgery to check in on them, right? Give them instructions on what to eat, how to brush their teeth, right? And what to avoid, right? Sometimes your wisdom teeth are really big, and when you have the wisdom teeth gone, you have to realize that that is an area where you don't have bone. That is like structurally, that's an area where the jaw is weak. Bone takes, you know, months to heal, sometimes 3-4 months, okay? You want to have them, you know, stay on non-contact for a little while. And then get them in for follow-up. Typically what I do is I have them in a week after, okay? Show them how to rinse the sockets, how to keep it clean, okay? And really that just goes back to, you know, different ways to, the main way to put patients at ease, just making sure that you're there for them, right? They want to make sure that you're there for them. Sometimes they don't have any problems, but they just want to make sure, okay, you know, Dr. Tsai, Dr. So, Dr. Quinton is looking out for me. You know?